It has been a minute since we've checked in with Upstate Global Health Director, Dr. Stephen Thomas, so let's do it now.
Great to see you. Thanks for being here. Really appreciate it.
Thanks.
So you just got back. I mean, you're always at different conferences, but a very big global conference in Germany on infectious diseases, which is your specialty. What was one of your bigger takeaways from this conference, from doctors around the world?
Yeah, so I was primarily in the sections on respiratory virus infections, so RSV, influenza, COVID-19. And we talked a lot about the sort of indirect effects of these respiratory virus infections, primarily influenza and COVID-19. So you get your infection, you might get your respiratory symptoms, but then after that, you're at much greater risk for developing major adverse cardiovascular events like heart attack or arrhythmias or blood clots, things of that nature. And so that was part of the story. The other part of the story, which wasn't really surprising, is that vaccines can significantly reduce your risk of having those secondary adverse events from that acute infection. So it is another part of the story that vaccines are really effective at helping people stay well and avoiding some of these
beyond just the initial what they're targeted for.
Exactly.
Right. And I'm just curious, do you track that, the after effects?
Yeah, so these are very large studies done in multiple countries around the world that include millions and millions of people, and many of them are done in the United States. They're done in Europe as well, and yeah, it can be either groups that are actually following people long term, or you can access medical records from big databases, insurance records from big databases, and multiple groups have all come up with the same conclusion. So it's been a reproducible finding that respiratory virus infections are bad. Vaccines that can reduce the severity of them are good.
Yeah, the research to prove it.
Yes.
Just want to talk on some other topics. The CDC blocking publication of the report of the efficacy of the COVID-19 vaccine. Your reaction to that?
I thought you were going to ask me about that.
I haven't talked to you in a while. I said we were going to get to a lot.
Yeah, I mean, I think it's very unfortunate because the professionals at the CDC who do this research and who put this information together, and in many cases academic collaborators and people from big, large health systems that do all this research, it is of the highest standard and of the highest quality, and they use very standard methodology that we have been used to for what we call real-world evidence, right? And this particular study, because it did make it out, someone got a copy of it and put it out on the internet, of course, and it was basically showing that it can reduce the likelihood of having to go to an emergency department for COVID-19 or getting admitted to the hospital or having even more severe outcomes. It can cut your risk by half. So the fact that they would not allow this to come out, and the fact that they would say that it has to do with the methods, I just find highly, highly suspicious.
I'm curious then what you think of a decision by the Department of Defense to no longer require military members to get the flu vaccine. And for those who don't know, you are a military person. Right. You were in the Army, right?
Yeah, I did my training at Walter Reed, and I spent 20 years in the military, and my whole job and all the people that I worked with, the whole job was to preserve military readiness, which means to keep service members and their families, by extension, safe. And vaccination is a key tenet of that. It is really incredibly ironic because who do you think developed the first ever licensed flu vaccine in the United States? The military. Yes. And the reason they did it was because they saw what happened to service members in World War I, and that's when we had, the massive pandemic, global pandemic. World War II was on the doorstep, and they said, geez, we really have to be able to protect our folks. And so that's why they started working on an influenza vaccine, developed it, tested it broadly in a lot of service members, ultimately licensed it, and it decreased the risk from influenza more than 80% in the troops. So I just find it ironic that now, 70 years later after the mandate went into place, they're getting rid of it, and they're using certain concepts about freedom and all these other kinds of things to try to justify the decision. I think in the end, what's going to happen is what we have seen time and time again when you take away vaccine policy is you're going to have lots of people getting sick. You're going to have some people getting severely ill and possibly even die. But you're going to also have real disruption to military readiness and operations. So people who get sick and don't die, they still can't do their jobs for prolonged periods of time. So it's going to be, unfortunately, I think we're going to see some really bad effects of this policy.
So one last one, about 40 seconds left here. It seems like a lot of what we've talked about is even adding to the confusion that's out there from politicians, policymakers in regards to medicine and the health of our nation.
Right.
How do we cut through the confusion and the clutter?
Yeah, you know, I think, and it pains me a little bit to say this, but unfortunately, I think the sources that we've normally gone to in the past to get our information, whether it be CDC, FDA, et cetera, they do not seem to be as reliable anymore. I'm not talking about the professionals who work in the day-to-day on the front line. It's the people that have the microphones that I'm concerned about. So I think the best place to go, and I've said it before, your local Department of Health, the physician or clinician who's cared for you and your family, you know, for a long time, and medical specialty societies. So American College of Obstetrics and Gynecology, American Academy of Pediatrics, Infectious Disease Society of America, American College of Physicians, I could go on. These medical specialty societies are filled with experts in the field. They are putting out their own guidance that the states are aligned with, that the counties are aligned with. That's where I would go to get my information until further notice.
And you're one of our trusted sources. That's why we have you on regularly. Dr. Stephen Thomas, thank you.
Thanks.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.